Good evening. They are children who have never seen a dentist. Now questions are being raised about a company that says it is trying to help them. Small Smiles opened an office in Rochester 2 years ago to help low-income children. Now, a disturbing videotape is drawing attention to some procedures that may put children at risk. We do want to warn you that some of the images in this report coming up are difficult to watch. I would also caution you, if you have a small child or a child that's scheduled to go to the dentist soon, you don't want them to watch this report. We'll excuse them from the room and give you a chance to do that. 13 WHAM's Jane Flash has our 13 WHAM investigation.
Jennifer McDowell travels with her children all the way from Dansville to Small Smiles in Irondequoit. She's not allowed to watch while her kids are getting fillings or other dental work, but that doesn't bother her.
It's understanding because they're more calm when their parents aren't there for them to want comfort from them.
Small Smiles have a policy parents can't watch, but on this day, a camera did. That's 4-year-old Miguel. He's being restrained by his dentist on a device called a Papoose board. His arms and upper body are held at his sides by wrapped canvas. He visits the Small Smiles office in Maryland, where Papoose boards are used half of the time. Papoose boards are also used here, but we were not allowed inside the offices on Ridge Road. Do you have a problem with your child being restrained like that?
No.
Why not?
Because it's better for their own safety. Okay. Because when they're in there pulling a tooth or cutting or whatever, if they move, they could cut their face.
The American Academy of Pediatric Dentistry warns that stabilization devices like Papoose boards have the potential to harm patients and should only be used in extreme cases when patients are a danger to themselves or to their caregivers. A spokesman in Washington, D.C. says these devices are never used without a written consent. Parents decide in consultation with their dentist. Small Smiles is opening 3 clinics a month around the country.
What we know and what we do great is provide quality care to kids that really need it.
Their website points out they are doing a business most won't, treating children on Medicaid. The government traditionally reimburses less for dental care than private insurance does. Many of these children have never seen a dentist. Yet the director of the Maryland Small Smiles says there's another reason Papoose boards are used: convenience.
You could potentially spend 2 hours on a kid who's not stabilized and moving around. That's not cost productive for us.
I like all these teeth. They're nice and shiny and clean.
Dr. Kochman is a pediatric dentist in Pittsford. It's his policy never to restrict parents. In some cases, though, children respond better when their parents are not in the room.
The parent might be a distraction for a child.
In his office, closed-circuit cameras allow parents to see everything from another room. And in cases where children suffer severe anxiety, Dr. Kochman uses other techniques, including sedation, before restraint.
It should never be used to try to overpower a child to do something because you want to do it.
The American Academy of Pediatric Dentistry recommends restraint be discontinued when a patient shows severe distress. Back in Maryland, that did not happen for Miguel, raising the question whether these low-income children are getting access to the same caring treatment. Now, last year, the director of the Small Smiles here in Irondequoit pleaded guilty to Medicaid fraud. David Douglas Gardner admitted to billing Medicaid for procedures he never performed. He served 6 months in prison. Investigators say it was an isolated case here and that Small Smiles did pay back $400,000. Several parents contacted 13 WHAM News with concerns about the way their children were treated at Small Smiles here. They did not want to be interviewed for the story. And again, we were not given any access to the facility today.
We, of course, Rochester trains a good many dentists with Eastman Dental Center, and we have the clinic there as well. Was there any comment or observations that they had offered?
Well, it's interesting because they treat children who also don't get regular dental care, so they're used to this population. They did not want to comment directly on Small Smiles. However, they say they also use sedation for children with severe anxiety. In fact, 2 days of every week, these children actually get dental procedures done in the operating room at the Golisano Children's Center to prevent the kind of thing that we saw here.
All right. Hey, thank you, Jane.